All right, everybody, welcome to another edition of the Leadership and Television Show with your amazing host, Ricardo D. Rice. And today we're doing all things dermatology.
Woo.
So I'm so excited. Y'all know I get a little crazy when I have family here, and today family is here. So I'm so excited to have the doctor, Dr. Nikki Hill. How we doing today, cuz?
Bless, awesome, all
Don't
of
she look
those.
amazing? She always looks amazing.
thank you.
And shouts out to my other cousins back there, Lauren. We're so appreciative of you two being here with us today.
Yes.
So we're talking about all things dermatology today.
Yeah.
You know, what is it? Things that we should look for. I think the objective we're going for today is, especially for our people, what are the things we should be looking for? You know, little blemishes or stuff that show up that we should be like, oh my God, I need to get that checked out, versus, oh, I'm good, let's go take a shower and let's go out. Now, I want to get into all that stuff and myths about hair and all that stuff and
Yes.
so all that good stuff. So we're going to start
Yes.
with you. Tell us about you and your journey and all that good stuff.
Absolutely. So I'm a dermatologist, which is a doctor that specializes in hair, nails, and skin. So my journey started, I went to Clark Atlanta University right here in Atlanta, Georgia.
God, here we go.
Oh, yes.
Here we go.
And then went to Boston University for School of Medicine. And at that point is when I started understanding, okay, I need to make a decision what kind of medicine I want to go into. You get in school, but you know they don't tell you how hard it is to get out of school. So at that point, I actually started doing some rotations in a hospital. And there was this one young girl in particular that was going through full organ failure. Like things just start shutting down within a matter of days. And we were trying to figure out what was going on. And we start calling all these different specialties, the heart doctors, the kidney doctors, the lung doctors, the eye doctors, because everything was just shutting down. And then suddenly she started getting rashes, and my team was like, well, let's just call derm. You know, she's saying they're itching, they're irritating her. Let's just call derm, because we're trying to figure out what's going on. We're trying to save her life. But let's call derm because there's this skin thing going on. Dermatologist came into the door, looked at the young lady and said, this is what her diagnosis is. And we're like, what? Just from looking at the skin. So then at that point, I was like, who are these magnificent, just superstars?
These unicorns that showed up. Who's these
These
unicorns?
superheroes. And then I started learning that, okay, that's what dermatology is. It's the study of hair, skin, and nails. So then it was kind of cool because it was like the skin manifests what was going on internally. So your hair, your nails, your skin, those are all kind of barometers of what your overall health is. And it's something you can see. So sometimes people have walking around with blood pressure that's high, they don't know that until they start getting headaches or other things. But if your blood pressure starts going to a certain point and you start having vein issues to a certain point or having other problems, sometimes they can manifest through your hair, your skin, your nails. So you can start shedding, you can start having rashes, you can start having other things. But it's kind of interesting how a lot of conditions, they can manifest in those ways. So I started looking a little bit deeper into dermatology.
Well, hold on, let me ask you a question because I'm curious.
Mm-hmm.
So you know I watch Grey's Anatomy.
Oh, Lord.
So
Oh, Lord.
work with me, work with me.
Oh.
So,
I'm listening.
well, since you did the medical school thing, the medical school route, is that really what it's like? Like y'all work those long hours, you don't really have a social life, and then you kind of have to pick a specialty within a certain number of years. Is that really is that what it's like?
Yeah, I actually went through straight into dermatology. A lot of my colleagues at the school had already lived a life. They had already had a career. They had already had kids and were married. And so they were at a point where I felt it was kind of almost like an advantage because they had lived. Versus when you're a career student, you're just going. Sometimes it's difficult to take that time away and realize the world is happening, life is happening. I mean, I was sitting in a little windowless room, just sad, scrolling on Facebook, like, oh, because life was happening. And you're just like, all I have is my book and my lamp, And you had to have UV lights because that's the only way you're going to be happy. So you have to have that passion and you have to be able to see the goal because it's very easy to get sidetracked and it's very easy to kind of find yourself in this way. So I really leaned on my team members. I leaned on my best friend to this day, Ebony. She was my roommate. We studied together. So it was like, I don't feel like studying today. She's like, oh no, we're going to study. Okay, and vice versa. You need that because sometimes you have to have someone to kind of be your accountability partner. So I mean, yeah, you're there in school. You go home, then you study. I mean, it teaches you how to learn and grow and, you know, then when you get with patients, that's when it actually starts to click because now you're actually able to apply all that book stuff, being in the dark rooms. Now you're actually able to apply it to people and you're able to see how that actually can benefit individuals. And I thought that was like the coolest part of the transition because the first 2 years, it's just grueling. You're just like bookwork. But then when you finally get into the doing exams and talking with people and knowing their stories and listening to their stories to find the clues of like, I know what's going on with you. I understand what's happening. You hit all these points, so now I know these are the things we need to look into to make sure if you have these conditions or if you don't have these conditions. So it was kind of cool to know you have all these lists in your head of all the symptoms that go with all these diagnoses, but then you're listening, are you checking the boxes, and then what boxes are you not checking, so I know what you don't have. So it was cool like that.
Well, I asked because, there's a shortage of doctors and things of that magnitude, and we definitely want to get our African-American kids to start going more into that field. So since I have an expert here who's gone through it, I figured I'd ask that question because, I really want to paint a picture of what it's like to go to medical school.
Oh, yeah.
Doing the MCAT and all that kind of stuff.
It's definitely rewarding. And I'll tell individuals, like one thing that I was actually really, really blessed about was at Clarkland University and a lot of HBCUs, there are programs where they're called early medical school selection programs. So I actually would have graduated in 3 years of undergrad because my senior year was spent in Boston doing medical school courses. I think the only thing I had left was physical PE. So I was doing ice skating. I was doing.
I'm about to say, y'all do PE and
yes,
I'd have been excited about PE.
So that's all I had to do up there. But I was taking medical school courses. So there's these early selection medical school programs that are particularly at HBCU schools that are really awesome. And also just making sure you're doing your MCAT studies and your preps. Research. As soon as you get into college, even if you don't know if you want to be in medicine, you wanted to start doing some research, going and shadowing doctors, going into private practices or hospitals, ask if you could be an intern, even your pediatrician, your mom's doctor, anybody. Ask them, hey, go with them to their appointment and say, hey, do you mind if I shadow you one day to just kind of see what the life is in a day of a doctor? I have my patients, and I love my kid patients because, I'm always like rooting them on, go, what's next? And they feel comfortable to the point where they'll be like, Dr. Hill, can I come shadow you? And I'm like, yeah, absolutely, come through. But that's what you want because you want to encourage them. So absolutely that can be done.
All right, so we're going to take our first break, and when we come back, we'll have more with the doctor, Dr. Nikki Hill. So stick around the Leadership and Television Show with your host, Ricardo D. Rice. All right, so we're back from break with the amazing Dr. Nikki Hill. So when we left, we were getting a holistic picture of what it was like when you were in medical school. The programs that you talk about, what are some criteria to get into those programs? I know they just ain't accepting anybody.
No.
So what are those criteria? Now, little sidebar, at the wedding, your dad said a lot of stuff.
I know everybody knows my life now. Everybody knows my life.
About your track record. So let's be very clear. Dr. Hill has been exceptional for a number of years. So let's be very clear about that. I don't want to say that disqualifies you, but I'm not saying it doesn't disqualify you. But what are the criteria for some of those programs?
Absolutely. So usually there is going to be an application process. There has to be some interest in research, or at least have done some research at some degree. And then there's the interview process. So you're going to go up typically to the school, and you're going to spend about 2 or 3 days there interviewing current colleagues on the staff of the medical school, as though you're already, doing your true interview for the medical school entry. And then after that, you're going to have a good academic standing, of course. And then once you go in, you're still on probation. The way I did it, the way the program I was in, your sophomore summer and your junior summer, you're spent there actually doing courses. So you have to do well. And if you pass those courses, because that's the amazing thing about med school, it's a pass-fail situation. So if you pass those courses and you also pass your undergrad classes, because you're still in undergrad, and then you have to take your MCAT. You have to get a sufficient score, and then you can matriculate.
What is a sufficient score?
I don't know anymore. I don't know.
I'm gonna let you ride on that because I'm gonna let you. It's been a minute.
So it was a blur. But yeah, those are kind of the criteria, and you just have to want it. They understand passion, because I think now a lot of med schools are understanding they can't really chase numbers too much, because you can chase numbers and you can't teach people how to be kind. You can't teach people bedside manner. And I'm sure, everyone, or you've known someone who's gone to a doctor where you're just like, they were so cold. They were just like, it was just not the vibe. So they're now understanding they want well-rounded people. I remember one guy that was at my school, his whole background in undergrad was dance and theater. Like that was it.
Really?
That was his life. He had did professional dancing. He was in Broadway, and then, but he took the MCAT. He wanted to do some research, and he got in. But they weren't well-rounded people.
Did he graduate?
Yeah, he graduated.
I have to ask
He
these questions. I mean, I haven't heard about a ballerina dancing around, because everything makes it viral. I haven't seen him dancing around the hospital, so.
Oh yeah, no, he graduated. He was
Okay, don't give me no bad examples now. He's dancing around.
I know, that's a good
the hospital.
point. That's a good point.
No bad examples.
Keep me honest.
Anything that caught you off guard going into medical school that you didn't foresee?
I think just how difficult it was to match in a residency program. So what was also difficult is you don't really know how to navigate the whole process of school. Not a lot, but a good number of my colleagues at school, they were second generation, third generation.
Oh, so they had the blueprint.
Fourth generation. They knew the blueprint. They knew what they were supposed to do. They knew they were already having publications by the time they got to med school. Like they knew this.
That's a thing?
That's a thing. That's a thing. I mean, I did research in undergrad, but I didn't know you had to be like published and stuff like that.
I didn't think you really did that until you
But it's just things to boost their application. They understood that. So once it started getting to residency, the match process, that was just a whole nother step of having to learn what it's like and what you had to prepare for it. So then you start having your meetings with your dean. You start having to understand you got to create your application. It's like college where you have to do your application, do your essays, but now they're looking at everything again. So now what's your research? Have you published? What are your means of saying that you're actually interested in this field of medicine? Because I wanted to do dermatology, which was, that's like every field of medicine is important, right? But it's a small number of programs, and they usually just have between 1 to 3 on average students they accept every year. And so on top of that, they go after, AOA, which is the American Honor Society for medical students. They go after the top 2%. So if you're not, because they can't, because you have that small selection, and why not? And so, yeah, my dean was like, it's gonna be an uphill battle, but we gonna get this. And I was very grateful for that individual. And actually, they weren't my dean; they were interim chair of dermatology at the time. And I was so grateful for that person because he ended up helping me understand and linking me with Emory to do some research here. So I just trucked my little self down to Emory for a whole year. I split my last year of medical school in half into over 2 years span. I did research at Emory in dermatology. I did classes where I could sit in and work with the dermatologist there. I went to their grand rounds, which is their weekly session where they talk about difficult cases and how to treat them. And I did all that for free because I was like, I got to get into derm. And it paid off, and I'm thankful for that. But it's like, did I know it was that difficult? Because I was like, okay, you get into med school, that's it.
Yeah,
I'm giving y'all my money.
After that.
Y'all should help me. Of course, I can pick whatever field I want to get into. But then, oh no.
What would have been your second choice? I'm just curious.
Ophthalmology, eye doctors. But then let me tell you, because they were almost a little neck and neck, almost. And then I went and did I sat in on it was like a cataract surgery.
Like, what did you think you were going to be doing? Come on, Nikki.
Because I did, the regular exams, they're like, oh, blink, little puff of light. Okay, can you see the things, the eye exams? That was fine. But that surgery, and I don't think that patient was like all the way to sleep because he was like paralyzed, but he could like kind of make groaning sounds, and then he could see, and then like a little needle was coming towards his eye, and he was like, nah. Again, I don't think that's the regular. I think everyone goes to sleep now.
I'm about to say, was that the problem?
But that was too much.
Or like
no, I don't know.
I'm more concerned with the fact that your second choice
I think everyone's knocked out.
Like,
oh, sorry. Go ahead.
I'm more concerned that your second choice is ophthalmology. Like what?
Lifestyle.
Well, okay. Well,
lifestyle.
Okay.
You're still helping individuals, all ages. I thought the eyeball was cool at that time.
If I wasn't concerned, I'm more concerned now. But we're gonna take our second break. When we go back, we'll get back with this foolishness that's going on. But we'll be back from commercial. Y'all stick around the Leadership in Television show. All right, we are back on this week's episode of the Leadership in Television Show with my amazing cousin and doctor, Dr. Nikki Hill. All right, so we talked about that. I'm still not over this whole optometry thing, but we can move on about it. Hair, black hair. Let's
The pandemic.
I mean, from bundles to glory is what we from bundles to glory. So let's get into some hair, some myths about hair. Wigs. Yes or no?
That kind of goes back to protective styles. Yes, but everything's in moderation, right? Too much of a good thing can be a bad thing. So one, I'll tell patients, actually be mindful not to do wig caps directly on your hair. The reason being, those caps are made of nylon, they're very tight, and next thing what you're noticing, they're pulling out your edges. And we already know edges are at like a deficit. So you don't want to pull them out. So wig bands are really nice because if you've not heard of those, they're like a little thin piece of almost like velour type of material, and it Velcro wraps. But that will protect your edges and remove any of that pressure that a wig cap or the lace fronts from the wigs can little by little rub away and get rid of those edges.
So the edges. Explain this. What are edges? Like baby hair? What? I just see people now.
I don't know if y'all
take a
gonna
little
zoom
toothbrushes.
in with a little edge.
I mean, your locks, your nice locks. But is that something that's hereditary? Are you born with edges? Is that remaining baby hair? What are edges? I'm at a loss. Help me out, dog. What are edges?
So edges are just hairs that are a little naturally miniaturized. They're going to be smaller, they're going to be finer, they're going to be softer, and they have a different curl pattern compared to the rest of the hair. So they're usually the hairs that are going to line the perimeter of the scalp. You are born with them, everyone has them. However, they can go away with genetic concerns, they can go away with trauma, they can go away with tension, which is usually what happens when there are things that are applied or glued to the area and removed inappropriately, or there are braids that are tied down too tight, or there are things that are just too much pressure. Over time, they can start to cause pressure atrophy, which makes the follicles smaller and finer and thus go away.
Once they're gone, are they gone?
If they
or can you eat like carrots or something, they come back?
Oh, I wish. If only. What happens with those hairs is a lot of times they're so small and fine, and the whole depth of the scalp, they're very superficial. So it's kind of like a trunk of it or the root of a tree. If you have like a little small baby thin trunk of a tree, it's a small root system. If you have a large 100-year-old oak, that's a very wide tree, that's a long, deep root system. So the same thing with hairs. Those little small, fine hairs, they're anchored very superficially in the scalp. So it doesn't take much to pull them out or much to damage them. And if you pull those hairs out, the body just sees an empty hole. It doesn't know that it needs to regenerate a new follicle. So then what happens, it says, open hole, we need to heal this, closes it up with scar tissue, and thus there becomes smooth areas. So that's why it's important to make sure you take care of those baby hairs and you take care of those edges because they can easily be removed.
When you said protective style, explain that. What is protective styles?
So in the African American community, protective styles generally begin as styles that were preventing your ends from having to have a lot of wind damage, a lot of maintenance damage, and just a lot of less maintenance in day-to-day and wear and tear on the hair. So for example, a lot of combing, a lot of brushing. If your hair would tangle, it would prevent you from having to untangle it or detangle it, which would cause a lot of breakage constantly. And when hair is out in particular seasons, it can dry out very easily. Like in the winter months, your hair can dry out. So if you can kind of protect it from those elements, protect it from the day-to-day, then you can potentially have a moment where your hair can lengthen and length retention. So protective styles are like braids, they can be twists, they can be anything where the hair is in a conformation where it's not free and out.
So is natural hair the best way to go? That's the new argument, weaves versus natural hair.
Honey, I'm natural, but it's a struggle.
But you got pretty long locks, though. So
and it's more of a struggle because you go on YouTube and YouTube feeds you life, and you be like, I'm gonna start this journey. I'm gonna do this, but YouTube can't be there with you when you crying at 2 o'clock in the morning that you got tangles and you don't understand. There's no product in the world that's gonna help you because you want her hair, but you realize her hair's not your hair, and her product's not gonna help your hair.
But isn't that the purpose of weave so that you can have her hair?
I mean, you can shortcut it. You can do what you need to do.
I'm just saying.
But
that's weave.
Everyone has their own journey. Natural hair is not for everybody, and there's a whole hierarchy of natural hair.
Yeah, I'm learning.
There's like natural with color, natural with texturizer, tech slacks, natural but I'm braids all the time, natural but I'm straight all the time. I'm natural and I'm straight right now. I went natural and about 5 years ago, and I was straight, and then 2020 hit, everything hit, and I was like, I guess we're gonna do this. So we were rocking it, curly, and it's fine, but it has to be part of your lifestyle. And for me, it wasn't part of my lifestyle. I can't dedicate about good 2 days just to do my hair. That'd be my whole weekend. I'd be tired.
That's how
going
much
back.
you take for natural hair?
For me, my hair type, it requires a lot of moisture, it requires a lot of handling, and it requires a lot of very dainty, let me just tweeze out this one knot, because my hair just curled in on itself. And yes, you can go to a stylist, but then again, I'm dedicating a long time to have to do natural hair in the
running a business, so
salon.
you don't have time to be sitting in nobody's salon for 5 hours.
I have all that.
All
So
kind of stuff.
I had to make that decision, and it was a movement to natural hair. And now a lot of people are like, even if the gurus have been natural the whole time, they're like, oh no, we going back to straight or relaxer. I'm not going back to relaxer, and there's nothing wrong with the relaxer. No such thing as a good burn, but there's no such thing as, nothing wrong with the relaxer. But I was like, well, let me just do what I can do, and this is where I need to be. Just kind of keeping it straight, but it's natural, but in a straight style and curled however I need to. I know I'm still confined to having to go to a stylist, but the stylist I found more recently, good. She's good. So that makes a world of difference, making sure you have a team.
Okay. All right. We're going to take a break because I want to get into the next segment. It's going to take longer. So we're going to take a break, and when we come back, we'll have more with Dr. Nikki Hill on the Leadership in Television show with your host, Ricardo D. Rice. All right, we are back on another episode of the Leadership in Television show with your host, Ricardo D. Rice, and my very special guest, Dr. Nikki Hill. All right, so now we get down to the serious stuff. So with dermatology, like you were saying in the beginning, the body kind of shows what's going on in it through hair, nails, things of that magnitude. What are some conditions that we tend to overlook that may be serious, like little blemishes or stuff that we overlook?
So a lot of times, acne, right? So sometimes patients come in, they've never had acne in their life, and all of a sudden they're having acne. So we have to understand, where does it come from? It's inflammation, but it's manifesting in the skin. So that can be influenced by your immune system. So stress can affect your immune system, which can affect your cortisol levels and affect your hormones that can cause acne. Your diet, sugar, dairy, and carbs, all the delicious things, those can, I know. What happens is you ingest the sugar, it breaks down to, or whatever you ingest, it breaks down to sugar. You need insulin to bring that sugar down, but then the insulin goes and it can flare up inflammation. It's pro-inflammatory, so it can flare up your arthritis in your knee. It can flare up your GI issues. It can flare up your acne. It can flare up heart disease. It can flare up your diabetes. So that's why you always want to be careful in regards to what you're putting in your body and what you're doing and what you're experiencing, because that can manifest through your skin. Of course, many other conditions, but when patients come in, all of a sudden they're having a lot of acne breakouts, and even women in particular age groups. There's 3 waves of acne: teenage years, 30s, and then perimenopausal. So patients will come in and say all of a sudden they're having acne. They don't understand what's going on. And we're looking at what's in the background. We go through all those parameters, and then sometimes we hit in on it's hormonal. Your body shifts and changes at these 3 times in life dramatically. So what's going on, because that androgen excess and surge is causing hormonal acne just in the lower jawline. So that's one condition.
All right, let me ask, before you move on, let me ask this. When we say acne, are we talking about like the patches or bumps and stuff that we seen when we were kids, or does it look different?
It can look the same, or it can be different. There's different flavors of acne. I know.
First of all, I like flavors of ice cream, not acne. So that was that was creepy when you said it, but okay.
Little flavors.
That's gross. You keep saying it's gross.
So you have like the blackheads and whiteheads, which we call comedonal acne. Then there's cystic acne, which is the deep, painful under the skin acne. There's inflammatory acne, which a lot of people equate in kind of younger years, where they get pustules on the face. I know. And then hormonal acne, which is sometimes a little bit of combination, but it usually affects just the lower jawline area.
So it's like just bumps that come around here?
Usually around a menstrual cycle for women. But typically what we're wanting to monitor and is find out what these triggers potentially are, so we know how to alleviate them or how to adjust them, so that way we can calm down the acne. And then usually we're also doing like a little skin regimen or treatments to help with the blemishes and help with the active acne.
Okay, I'm going to segue. because there's been a lot of talk lately about black women and things like heart attacks and things of that magnitude. Are there certain things that they should look for, high levels of stress that will show itself on their bodies that they should be paying attention to?
Absolutely. So stress, it can manifest in different ways, but in my practice, because I'm hair, nails, and skin, a lot of times stress will manifest as aggressive shedding of the hair. It will manifest as a lot of acne on the skin. It can manifest as their psoriasis flaring up and getting worse, their eczema flaring up and getting worse. Again, anything inflammatory. And a lot of things that we see on the body, on the surface, are inflammatory. And also scalp conditions. There's medical conditions where you have inflammation in the scalp, which just like anything stress flares inflammatory, it can flare up the scalp. So patients start noticing they're having a lot of breakage, they're having a lot of pain, they're having bumps, they're having excessive flaking that's not calming down on their scalp.
So should we be concerned with the time frames of these things? Because if I see it today and it's gone tomorrow, I'm probably not. But how long is too long?
Too long is probably going to be, well, it's all subjective. Some people say 24 hours is too long. But something becomes chronic when it starts to get around 6 weeks. Now, if you're shedding progressively, like aggressively every single day, by the time 6 weeks hits, you're going to...
You be bald.
Let me speak for myself. I was in it's a spiral of emotions and it's scary. And then you don't know why you're losing your hair. You don't know why it's coming so fast. And it's a scary spiral of emotions. So the same thing with acne, because every time an acne bump is there, it leaves behind a blemish. It leaves behind either a red spot or a dark spot. So not only are you dealing with the stress of acne, but now you're dealing with the stress of every single sequela of having an acne bump. You're constantly walking around with the dark spots or the red spots. So absolutely.
So those are givens that you're going to have a reminder once these things leave.
Yeah.
Does that get worse as you get older?
Well, technically, your oil should start to normalize where you're not breaking out as much. Now, every cell ages over time. So cells have a shorter length of growth than being alive. So that's why hairs sometimes get a little bit smaller or finer or shorter. That's why collagen is not made as fast as when you were nice and young and robust,
Thundercat,
little tenderoni. You made collagen just as fast as you broke down collagen. So when you get older, you make collagen slower, but you're still breaking it down the same way. Sun breaks it down, stress breaks it down, what you eat prevents you from making it as fast. But even if you're in your top health, you're still going to slow down in your collagen. So that's where the aging effect happens. And then, they say black don't crack, but I always say it bends with time. So you have to be careful.
Okay, I can
you want to wear your sunscreen. You want to make sure you're doing your vitamin A creams at night, which help plump up that collagen. Antioxidants help also stimulate some of that collagen and prevent antioxidants that break down the skin, which is from the sun damage. So there are things you can do to help preserve so you can be that fine wine.
Well, I just turned 42 and I still look good. So.
I know, but genetics, right?
Facts,
genetics.
Facts. All
genetics,
facts.
They'll hold people for a very long time. But when it starts to be a little weak, that's where I'm here.
I'm slightly concerned. Actually, okay, so I'm slightly concerned. Okay, so the sun thing. How necessary is the sun for melanated people? Because I think now people are starting to talk more about it. I don't think most of us think anything about it. And apparently now it's a thing that we should be doing, that we should be getting a proper amount of sun. How true is that?
So everyone is going to get sun on a daily basis. It's just there's always, again, too much of one thing is a bad thing. You've seen individuals who are potentially not as blessed melanated, and what happens to them in the sun?
Yeah, it's not perfect.
The skin gets thicker, it gets a lot more folds and wrinkles in there, things happen. Colors happen, things happen. Now, in melanated skin, that you are protected from that radiation from the sun. So I always say your melanin is like a little umbrella over the nucleus of your cell, which is where all your special DNA is.
Sounds so doctor-like.
All your special DNA. So when there's sudden bursts of sun, your cells throw up this little shade. They throw up shade. So now you make a little extra melanin, so you get a little extra chocolatey. But that's protecting your DNA so it doesn't get all that radiation and turn to skin cancer. Patients who don't have melanin, they don't have that umbrella to protect them. They can tan a little bit, but they can't tan to the point where it constantly protects them. And over time, they can start to have skin cancers because those cells get too much radiation, and then they start going awry, and they start creating skin cancer. So skin of color patients, sun is fine. but you don't want to overdo it. You can still get sunburns. I got a sunburn when I ran track. I didn't understand what's happening. I was like, it feels like sandpaper and it stings. So you got to be careful. Wear your sunscreen, at least SPF 30 every day, all day, every day, every day, every day.
Is that in some kind of lotion I can buy? Because I'm not about to call 2 things of lotion.
So you can get your Pond's with the SPF 30.
Yeah, hey Pons.
But all facial moisturizers typically have an SPF built into it. You want at least the SPF 30 because naturally melanated patients are going to have SPF 15 naturally. So you need a little extra boost, so at least SPF 30. Now, if you're going down to close to some equator country or on somebody's island, then you need to go up higher. You need to probably go at least 50 or above. But you want to, on a day-to-day basis, SPF 30 is good for you.
Okay. Last question, because we kind of touched on cancer things. Is there certain things they should look for that might be a sign that you might need to get something checked?
Absolutely. No, I'm so glad you brought that up because skin of color patients, a lot of times it's not at the forefront of being protected from skin cancer or that they can even develop skin cancer. And unfortunately, the mortality rates are very high in skin of color patients. It's because it's detected late. There may be a little element of just not knowing that you can have skin cancer, so it's brought to the doctor later. And it's in areas that you typically may not look. So it's in the palms and the soles of the feet. It's in the bathing suit area. It's inside the mouth. So it's in areas that you wouldn't typically know to look for. Nails. Now what's kind of interesting is in skin of color patients, naturally with melanin being in the nail fold, which is at the top of your nail, right back here, you can have a little mole that makes a little line. And that can be natural. You can have multiple of those. But if you have one that's really dark, it's getting wider, it's now having some texture changes. That can be melanoma, which is a type of skin cancer happening right there. Melanoma tends to happen in bathing suit areas, in sudden hidden areas, as opposed to non-melanoma skin cancers, which happen on sun-exposed areas. So melanoma in people of color, unfortunately, is diagnosed later and at advanced stages because they don't know that mole on the bottom of their foot is something that needs to be addressed. That's what happened with Bob Marley.
Really?
Yes, melanoma in the foot. Yes. So it can happen. Not to take it dark, but you know.
I mean, I got concerned
it's a real
fast,
thing.
but you know, okay. Well.
And you just do a full body skin cancer screening. And then sometimes, you know, it may not be in the forefront to say, okay, let me go get a full body skin cancer screening, but you should, at least, you know, just peace of mind. Usually patients who have a risk for skin cancer will go once a year. If the risk, meaning there's not a family history of this condition, you know, and you haven't had like blistering sunburns and things of that sort, your risk may be a little bit lower. However, it's always good to just do a once over. Okay, this is a mole, take a picture of it on your phone. Put a little measuring tape or a ruler next to it so you know what size it was. And then 6 months later or a year later, look at it again. If something grew or changed, or even before then, you may want to have your neighborly dermatologist take a look at it.
That's a good segue. Tell us about your practice.
So Skin and Culture and Hair Center, SOCA Center for short. We are a dermatology practice in Atlanta, Georgia. And we are now actually celebrating our 6-year anniversary this month. Whoop, whoop, whoop. They say the first 5 years, right?
Facts.
So we are really focused on, me particularly, I'm focused on hair. So hair concerns, hair breakage, hair damage, healthy scalps, healthy hair. So that's my focus. We're actually expanding. We're bringing on a new provider. We're opening to a new space. So they're going to be focusing in on skincare and cosmetics and all those glorious things to keep you looking fabulous.
Oh, it's so nice when family expand. Isn't it beautiful? So beautiful. How do people get in touch with you?
Absolutely. So we have our website, socacenter.com. That's SOCA as in Apple, H as in Harry, center.com. You can also go to Instagram, Dr. Nikki Hill, DrNikkihIll. And you can also call us, 404-474-2301.
Any final thoughts that you want to leave with the people?
Just listen to your body, you know. If you see things, if you see rashes, if you're feeling things in your scalp, those are not normal, you know. Just be mindful of that. And if what salves you use at home doesn't clear it up, then do seek a dermatologist, because sometimes things can be scarring and things can have other kind of background reasons why they're manifesting. So just kind of be wary of that.
All right, so there you have it. Special thanks to my family, Dr. Nikki Hill and my cousin Lauren back there for being on the show today. And we will see you guys same time, same place on the Leadership Bend television show with your host, Ricardo D. Rice.